Our final presenter is Reva Yunus, who is a lecturer in education and social justice at the Department of Education at the University of York here in the UK. Reva researches the relationship between socioeconomic change and educational marginality in urban context. She's particularly interested in the impact of precarity and poverty on families and young people's aspirations, strategies of mobility, and political and economic participation. Reva.
So our group was talking about global institutions and sovereignty, especially in the context of healthcare and education. Like we said before, international agencies made the same set of recommendations for all the countries, but we have a problem with the one-size-fits-all approach in this. Not only do the same set of recommendations not work for all countries, they also have widely varying capacities in terms of resources in implementing those changes, particularly with poorer nations who have a whole other set of constraints and capacities compared to richer nations. There's also the old problem of representation and voice in international forums and global institutions. This becomes magnified in times of crisis when very important decisions have to be taken very quickly at very short notice. The other thing is that regional offices of organizations like the WHO were not mobilized and were not used. Their connections and their understanding of different contexts was not used to enable a more democratic process of decision making. And very importantly, international agencies did not focus on harms caused by any one country imposing trade or travel restrictions or locking down in any way on other countries, particularly poorer countries, which have already suffered a lot due to past trade treaties and so on. Economic sanctions, particularly at the time of lockdowns, we feel in humanitarian interests should have been suspended, and that has been done in the past, but it wasn't done this time, and it caused further harm to the most marginalized people in the countries that were subject to these sanctions. Individual nation states also failed to kind of develop and implement plans customized to their own situation and based on their own past experience. So the most marginalized groups in those countries, whether these were informal workers that we heard a lot about on the first day, women, children, minorities of different kinds suffered a lot. There was a massive difference between what happened in urban and rural areas as well within countries. Within individual nation states as well, democratic and representative processes have to be followed. We have to make sure that, especially that in this kind of a crisis, these processes are put to work instead of suspending democratic decision making, which we also saw in the edited collection on the costs of lockdown, that in every single country, particularly in the global south, democratic processes were kind of bypassed. So that is something that we really need to scrutinize. Aid conditionalities also played a role in the way nations could not take a stand against these recommendations in the interests of their own most affected people. So the conditional nature of responses from international aid agencies in general, and especially in times of crisis, is something that very much needs to be debated and reconsidered. And we also need to think about how to use regional forums, and I'm beginning to sound like a UN General Assembly speaker, how to use regional forums and develop channels of cooperation, oh my God, between third world countries. But the thing is, yes, these are all, this sounds trite, but we need this. This is why we failed this time, because we were not talking to each other. And so not only do we need to learn from our past experience, we need to learn from each other's past experiences as well. For example, for Ebola, Congo had developed some really brilliant strategies to work at the community level and move up. So those structures were not utilized. And when the first cases of COVID were officially announced, they had just said goodbye to their last case of Ebola that had been discharged. So this is something that we really needed to talk about. We should all have been listening to them. This kind of decision-making resulted in a lot of problems in healthcare and education, particularly with resources and staff being diverted from existing health programs. India, for example, has a massive problem with multi-drug-resistant tuberculosis. And we even stopped all of our regular TB monitoring and so on. And I've done research in one of the cities which has the highest prevalence of AIDS and TB cases in Madhya Pradesh, in India. So HIV, childhood immunization programs, all of these things were sort of abandoned. All the staff and resources were diverted to COVID track and trace and vaccine programs and so on. International aid was also directed mostly at addressing COVID. Similarly, in education, we've been hearing of all kinds of harms that children and young people faced because of the very widely varying circumstances, challenges, and capacities that different countries had. And school closures, like I pointed out earlier, did not work in many parts of the first world either. This is primarily because the social aspect of learning, of going to school, was completely ignored. So this is something that I emphasized in my own talk, but this is really true for all young people particularly, that's when they're learning to be social beings coming into their own. So this was really important for them. So it is not just about access to data or devices or learning outcomes in mathematics or English. It is about how you interact with other people, develop relationships, and develop that confidence to go out in the society. I'm seeing this in my own undergraduate students as well. They're really struggling and lost, and there is a massive increase in mental health issues for students. And so there was the problem of children. Nobody learned. Nobody learned. I couldn't see my students' faces and see whether they've learned anything that I'm saying, they've understood or not. So children did not learn, young people did not learn, they were very demotivated, and they developed a lot of health issues as well. And this has been very well documented by UNESCO, UNICEF, and so on. The other thing is that teachers' unions did not defend children's rights and interests, so this was a little bit problematic, but then they do represent teachers' interests. So who represents children's interests is something that we need to talk about. And again, this could be quite different in different countries as well. But this is something that we need to think about. Can parent-teachers associations be mobilized and so on? And what kind of information do parents receive on the basis of which they take decisions about supporting or opposing school closure? Another thing is, and this links with what Group 4 has been saying particularly, if the pandemic experience is used to justify changes to health and education policies, which were experimented with during lockdown, particularly in the name of pandemic preparedness, then we need to take all of this analysis that all of us have presented. This kind of analysis has to be taken into account, and we have to make sure that established democratic routes are used to bring in further policy changes. Not only at the time of crisis, but post-crisis, are we going to use that experience to then push through other changes in the similarly undemocratic ways? Also, instead of only seeing it as a unique event, we need to also see in what ways this kind of pandemic response policies, consolidated processes of disempowerment and dispossession set in motion over the last few decades, particularly again in the global south. And think about how the broader economic paradigm, how do we need to engage with the broader economic paradigm and think about investing in healthcare and education and making sure that there is greater public investment. If anything, the crisis has shown that that's what we massively need. So these are all of the things that we thought countries and international organizations and forums need to rethink. Thank you.